It's a first day after that yesterday's Googly. So we have Googly of NEET SS that we are preparing for our specialty now, the paper on the common general surgery pattern. So things to be discussed. Many students are in confusion ki what to do and what I have to read in this time. What are the things they can leave, and what will the pattern? How the questions will come? How they have to divide their time. So for that, this meeting we arrange. Now we have Vinay, Dr. Kanchan, Dr. Shiven will join, Mana will join, and Dr. Anuj will join. So we'll see how can we prepare for this NEET SS 21. So Kanchan ma'am, you can unmute yourself.
I'm already there, Vipin. I can hear you.
Yeah, Shiven sir, welcome.
Hi.
So Shiven sir is there. Kanchan ma'am, are you there?
Yeah, I'm there.
Vinay?
Yeah, sir, I'm there, sir.
Manav? Yeah. Anuj? Okay, they will join. So first of thing, what I have to say that don't panic in this time. This everyone is on the same boat. Everyone is preparing for their NEET SS specialty for last few years, few months, whatever the time spent for the specialties. Now time to common general interest. Same pattern was there when we gave exam, me and Kanchan ma'am gave the exam. It was a common general surgery based pattern and we cleared. So nothing to worry. It will be common. You already read general surgery in your MS time. You are reading for last 1 year, 2 year. When you pass out from the MS also, because general surgery 40 questions also important. Even last year paper was very tough for general surgery. So people are reading more general surgery this time. So don't lose your confidence. You already have the questions. You already have the topic in your hands. You have good command in that. So no need to panic. So just think that you have 70 days, you have to read general surgery. That first, there will be no different paper for subspecialty. That should be clear. Many students message me whether they should continue oncosurgery, neurosurgery, gastro. It's not like that. Paper will be on general surgery base. That's clear from now. They will have question on that subspecialty like onco, uro, gastro, neurosurgery, vascular, CTVS or any other surgery. But the main pattern will be on the general surgery. So what the book you have to prefer. So what I did and what I suggest to everyone that Valley and Love is must for you. Yeah, you cannot escape Valley and Love. Each and every line is very much important. Then you have to read Pratesh Singh. Then you have to read our notes. Then things have to do like that. So what I personally believe, divide your time in 3 parts. So at least 3 times revision you should have. So first give you 30 days for the first reading of the general surgery part thoroughly. Second part, that next 20 days you have to give for revision. Again, that 15 days you have to give for revision. 5 days you can escape because you have some work in meanwhile. So, but at least 3 times revision you should do. Then second thing, how you will read the things what you know first, then revise them. And what are the things you don't know, mark them. When you are doing MCQ, mark the MCQ that you are doing this MCQ wrong again and again, you have to repeat. So mark the MCQ. Next time, only do the same thing, repeat all the things. Don't escape what are things you know or don't know, what you read or not read. Read all the things, but in a quick time of 20 days. Then next 15 days, read what are the things you don't know or you have confusion, you have things are you are not in confident kind of thing like that. And what I personally believe that you have to read like divide your topics. Like if you're preparing, you are reading some topic and oncosurgery part is there or tumor part is there. The TNM classification is for every tumor, every part is very much important. And read the treatment part according to the TNM staging. Then it will be easy. Second thing, exam will be the basic oriented. They will not ask you high-fi question. 10 to 15 question will be there out of 150, but that 135 question, some idea you will have. Only thing that you have to click. So read logically, this is a tumor TLM classification. So this is the treatment for T1 stage, T1, T2 stage, or stage 1 stage 2. Read the basic common facts of what are the topic you are reading. Don't go for uncommon or rarely things they are asking. So read basic part of that any topic. When you are reading any book, read first 2-3 lines very carefully. Read very that last 2-3 lines when the conclusion or exclusion of parts are there. Read carefully. read the tables, read the flow charts in the books, read the this one, the content written below the table, mark them. What is the odd, even odd things are there in the table or in a flow chart? What are the exceptions are there? What are the most commons are there? Like that pattern will be there. Question, I am guarantee it will be very much easy. If you remember or read 1 or 2 times with your full concentration, you will crack through the exam. It's very simple exam. Only thing that people are doing mistakes, they are not clicking on that time. So you have to revise yourself 2 to 3 times at least before your exam you go. And people are asking, okay, what are the things we have to read other than semester? So what I think in general surgery, you have to read from belly thoroughly. Urology, I think the belly is more than enough. Then CTVS pediatric surgery part, that you have to read belly basically, because they will ask simple question. What is the age of the hypospadias to be correct? What are the types of hypospadias? What are the classification of hypospadias? Like the basic question they will ask. They will not ask you what are the particular complication or particular technique name for the hypospadia, what they are doing. They will not ask like this. So everything you should remember and thoroughly you have to read. Like second thing, Sebastian part. Please mute yourself. So second thing, the Sebastian part. So general surgery you can cover with a belly, but for gastrosurgery you have to read Sebastian at least 1 time. So for 1 time you have to read Sebastian part, that is must. I will take all question in the last, and we have all our faculty who can give their opinion how to read in this time. So the second thing, Sebastian part you have to read this one GI part from Sebastian, that is must. Swards, the tables, thyroid, breast, that part you can read if you read. Otherwise, belly and Sebastian is enough for your exam. If you have time, you have already read belly and Sebastian, then you go for the SWOT. First cover what you already read. That's a more important, because that is the basic. So you know the things like 150 questions are there. So at least 80 questions or 75, more than 75 questions, you will easily go through. You know each and everything about that. And this is your basic. So read your basic first. Then go to the advanced part, like you have to read again, you have to go tough questions, you have to do the things. And last 30 days, only the MCQs and their explanation, MCQ and their explanation. That is important. You can subscribe any test series like my test series, any other coaching classes which are giving. Subscribe if you like them. Subscribe. I don't mind about that you are liking mine or others. You have to choose yourself which is better. So you go through that. Videos we have, you can subscribe our videos. So videos we have, you can subscribe our video if you like. We will provide notes of all that. We have monthly comp package. Subscribe for a month, then see. Then for NEET SS, this pattern, we are launching our test series. That NEET SS for general surgery, 150 questions every week we'll provide with a explanation of the belly, Sebastian and all. You can read them, you can use multiple times, you will have analysis of your questions each and every time you will give. So that will help you in preparation. So it will be around 10 tests till your NEET SS exam. So you can subscribe them if you like that. It's not an, see this meeting, why I created, because I just want to guide, because me and our faculty who've gone through the same stage when their exam was the same pattern. So we know how the questions are coming and how the people are thinking. You believe or don't believe, I prepared only 35 to 38 days for your NEET SS. But in 38 days, I almost each and every minute I gave to this NEET SS. In 38 days, I read belly, Sebastian and Pratyasi 3 to 4 times. I read before that also, but in the 34 days, I just mug up. This is exam of your mug up. First, your basic should be clear. Then you have to mug up the things. So this is the things from our side. So subscribe our NEET SS mock test series if you like. And then I will ask the Shiven sir, what is their view of to prepare. In last, we'll take all questions in the chat box. What are the questions you have chat box is put? We'll ask for every faculty what they have opinion. So Shiven sir, you can unmute yourself.
I've seen the questions. I've seen the questions which these people have asked. So firstly, what I want to tell you is up to 2016, it used to be every specialty, and then we also used to have a DNB exam which was separate. Okay, we used to have DNB separate exam and NCH separate exam. DNB exam was in the same similar pattern. So what I expect now is it will be something like that same DNB pattern where it had 200 questions and you were given 3 hours for MCH entrance for DNB super specialty entrance only, and then you had to choose the branch and also the college after you get your score. So I am going to discuss about this particular paper because I feel this is what is going to be the strength of the questions or the number of the questions that will be asked. Is that clear? So first point is there was lot of concentration on CTVS. In Sabiston, the chapters on CTVS, vascular, cardiothoracic and all, they used to ask at least about close to 25% of the questions. And that used to be the differentiating factor between the top ranker and the next few rankers. CTVS in when you have a combined question, because the DNB board feels that CTVS is very less neglected, is more neglected. Hence, most questions will not come from that. And because of that, what is going to happen is you can differentiate the people easily. So CTVS, we used to get out of 200 questions, close to 30 to 35 questions would be just from CTVS. Okay, they used to ask a lot of questions on ASD, VSD, atrioventricular septal defect, VSD, repair of VSD. What is the criteria for operating? What is the criteria for non-operating? All these things they used to ask. That is number one. Second important topic to be discussed was general surgery proper, like first 8 to 10 chapters of Sabiston, which had got how do you prepare a patient for surgery, cardiovascular fitness, pulmonary wise fitness. Those questions they used to ask like a clinical scenario. What is the next test in order to assess for cardiac fitness? So these questions used to be the second level questions. About 25 to 30 of them would be from this. Then important topics used to be breast and thyroid and parathyroid. Followed by that, you used to have questions on hernia and all these things. Then used to be GI, because GI has got multiple topics. Like you used to have gallbladder, then you have stomach, colon, small bowel, and all these things, all these topics used to be next in frequency when you take chapter wise. But the differentiating factor when we used to write this paper was when I gave my exam in 2015 and 2016. I wrote my exam for 2 years, 2015 and 2016. 2015, close to 30 questions, 30 to 35. Both the years, 35 to 40 questions were just from CTVS. Just 3 or 4 chapters that is present in Sabiston. According to me, when you write this DNB paper, it used to be a line that is directly picked up from the textbook. They used to just pick up the line directly and make 4 options out of these. And those 4 options, the one option would be correct. That is how simple it was at that point. I don't say simple, but I would rather say it used to be a direct line from from the textbook. They used to concentrate more on pictures. Pictures were the site where they used to take, because when you first see the chapter, when you first open the lesson, there used to be a direct, the first thing that you normally see is a photograph. So underneath the photograph, whatever the description is there, those are the things that you're supposed to look first. Second important things are all the tables. Make sure that if you just read all the previous questions from Pritesh Singh and just the tables and also just the simple, the photographs, they constitute more than 60 to 70% of the questions. And remember, out of the 150 questions that you get, close to 80 to 90 questions will be simple repeats that have been previously asked in the exam. And the moment you don't answer the repeats, 90 out of 90, you are out of the race. The first important thing is to make the repeats correct, and the repeats will be repeated most of the time. Around 80 to 90% will be just 80 to 90 questions will be repeats out of 150. It is only that 60 to 70 which will matter the most. So your concentration now is to divide into 2 tracks. My recommendation is, I would say, divide into 2 tracks. Your daily schedule of about 12 hours, 12 to 14 hours. Make about 5 hours. Ideally, these 5 hours should be in the time when you're tired for the day. Okay, when you're tired for the day, like after 6 o'clock, you get in another person along with you, and both of you just read the MCQ, mark the MCQ answer, and memorize the MCQ answer. So try to make around 500, 600 questions per day. So this session will start off from 5 o'clock in the evening till 9 or 10 in the evening. Morning time when you're fresh or whatever it is, that time I would recommend you to read some new topic like system-wise, either gallbladder, liver, or something like this. One day gallbladder, liver, and pancreas. And then you'll be doing the rest of the GI tract. one day you'll be doing thyroid and breast. So like that you divide. One day you'll test for urology. So what I would recommend is evening 4 to 5 hours for previous questions, and the most crucial or the time when you can concentrate the most or the best for some new topic. That would be the best way to divide your day and then concentrate on your. But remember, according to what my experience was when I with the same pattern that was there, it used to be like questions, 30 to 40 questions used to come from CTBS. Out of 230 to 40 means in 150, I'll be expecting around 25 to 30. That's what I want. And then related to what pattern, what is going to happen, ENT and all. So even if an ENT surgeon wants to join surgical oncology, he has to write the general surgery paper, first point. Or suppose you want to write head and neck oncology, you have to write the ENT paper. Okay, so you can choose both the papers. You can choose ENT paper as well as general surgery paper. But I think when Vipin wrote this same exam, it used to be like ENT had got his ENT paper, and based on the percentile, they were given surgical oncology or surgical gastro, and or if ENT person. So there was an opportunity for ENT people to directly join surgical oncology by writing an ENT paper, which was much easier. And it so happened that quite a lot of ENT surgeons now landed up in surgical oncology also. Right, Vipin? Am I right?
Yeah, you're correct. That time the same thing happened.
So it was based on the percentile basis. Whoever had a percentile, they were easily getting the. So ortho people, what happened was there were about 20 or 25 people who wrote ortho. Even if they got 91 out of 100, there were 19. They were equivalent to 99 percentile. General surgeon who got 96 out of 100 could not get a seat, but ortho guy who got 91 out of 100 could easily get a seat. That was the scenario in 2017, if I'm not wrong.
Yeah, that was the scenario in my exam. Same. So that time is a percentile based, and what are the percentage you get? Either you an ENT or obs-gynae, you can go through the surgical oncology. But what I say, this time they have to write general surgery also. So
Yes.
It will be tough for them. It will be not easy.
That is one. So next year they have removed it. But now what they did was, because they cannot write both the paper. Now they cannot do this. Now gynecology is writing a general surgery paper will be tough. ENT writing a general surgery paper will be tough.
Yeah, definitely.
So that way there is an advantage to the present general surgeon who are appearing for surgical oncology. I am talking about surgical oncology because that was the field that I belong to, and it so happened that out of the 3 juniors that I had, 2 of them were ENT surgeon and one was general surgeon. So the ENT surgeons later also had to face a lot of trouble, but anyway they got over it. But now it is not the similar thing. Even an ENT fellow has to write general surgery paper, and he will not get in like an ENT easy way. So that way, definitely you guys have an edge over the ENT people. So when it comes to the question ortho and ENT, there was one question which was asked, ortho and ENT, will those questions come in? My answer would be, if it is related to trauma, definitely they will come in. If it is related to trauma, definitely they will come in. They'll ask something like patient present with major fracture or something like that, with polytrauma, with a pelvic fracture and this thing with bleeding per urethra, something like what is your next line of management. So those kind of questions may come in, but they will not ask you what is a green stick fracture, how will you repair a green stick fracture, what are the surgical methods for a green stick fracture. Those kind of questions you will not get in ortho and ENT. In ENT, you may get something like bleeding from here following a trauma, what is your next line of management. Those kind of questions you may get, where you have to do a CT scan head and all those things you can get. But frankly speaking, ENT, how do you treat CSOM, how do you treat ASOM, how do you treat mastocytitis, all those things you will not come get in the paper. This is what I feel.
Yeah, it will
So,
be same.
Yeah, I don't think people have to panic with this. Rather, I would rather also say that you should take this as even OBG is the same thing, ma'am. Even if you are OBG and you want to write surgical oncology, you have to write general surgery. You have to take up the general surgery paper, and only in general surgery paper you should be among the top in order to get the seat. Suppose similar thing with gynec oncology. General surgeons want to write gynec oncology, they will have to write MS OBG paper and not general surgery paper. And if they want head and neck oncology, they will have to write head and neck ENT paper and not general surgery paper. This is probably little better than what was there in 2017.
Yes, correct. So, Shevan sir, be with us. We'll take all questions now. And the last, the people are asking question. The Kanchan ma'am is want to say something.
And what about head and neck chapters in Bailey for surgeon for this thing? You can get them. Most of the tumors you can get. You can get questions based on tumors. And Bailey and Love head and neck chapters, I don't think there's so much to read in that. I think you can hardly finish in any time. It's not such a wide thing to be. Probably they have given some infection related things, very minimal in nature. It is not so much that you have to, read day in and day out in order to finish head and neck part of it. And ENT people, we have to prepare for MCH head and neck surgery. Yes, you will have questions. For MCH head and neck surgery, you will have all the questions related to ENT per se. You will have all benign ENT, malignant ENT, and all questions in ENT, like how do you treat CSOM, how do you treat ASOM, how do you treat grommet insertion, all those questions you'll have. But a person who from general surgery will not get those kind of questions.
Yes.
I think Kanchan madam will talk more about surgical gastroenterology. Madam, if you're there.
Yeah. Hi.
Hi.
Hi. So
Hey.
basically, I would just like to reiterate the same things which you both have told. Firstly, with regards to 2017 pattern of paper which we have given, I would again tell that we would like see in my during the revision classes of the last revision, I had told only one thing, that the final consensus of getting a seat basically doesn't depend on your specialty, what you've read upon the specialty. It is based on the general surgery, because someone who has read better general surgery part than you, okay, definitely will fare well in the final ranking. So the general surgery part is was definitely important then, and it is definitely important now. So what I would suggest is, as Vipin sir also told, that Bailey, I would say that Bailey only the initial general part, okay, the trauma and the general surgery part which is given, not the gastro or the systemic part which is given from Bailey. So the first 500 pages, I think. And Sebastian, it is the whole Sebastian that you have to read. Okay, the whole Sebastian, and you should finish at least 2 readings of Sebastian as well as the first half of whatever first 500 pages of Bailey. That is very important. In the 70 days that you have, you can definitely finish it twice along with your questions. You can go through the theory part in the morning, as Dr. Shivendra told, okay, and you can go for the MCQs in the evening, be it your mock test series, or be it your any grant test which you have given, or the recent papers, at least the recent 4-5 years papers you have to read. So that is all it is. And as he told you again that the repeat questions will definitely come. So be very sure that you don't make a mistake in getting this repeat questions wrong. Okay, so you definitely have to make it right, because even one question that will decide the fate of your this thing ranking. Okay, you can get from gastro to somewhere down in. Maybe you can change the
Urology.
colleges according to the ranking. You can change the faculty according to the ranking. That is how it will happen. The stream will get changed. Okay, so these repeat questions are very, very important. But definitely, after you finish those 5 years, repeat the papers, previous papers, then you can start solving all these test series which you have already solved before. But morning time or whatever time, like this theory part, the whole Sebastian reading has to be gone through twice in this 70 days, along with the first half of Bailey. That is what I would suggest.
Yes, definitely, ma'am. You're right, whatever you have told. And for GI surgery and GI oncology, Sebastian, I think, is good more than Bailey alone.
Yes, absolutely. It is more than enough. And even if you have there are hardly any questions, hardly any questions which will come from the subject papers, subject books, like be it Shackelford or be it for Onco from Devita or this thing. Usually, if the general surgery pattern comes, your majority questions will be from Sebastian and Bailey. It will not come from anywhere else. Even if it comes from anywhere else, just remember one thing, that everybody is sailing in the same boat as of today. Okay.
Yes.
This bomb was
Everybody
just placed
in the same
yesterday.
state of panic.
Yeah, everybody's in the same state of panic, and you just have to keep your cool at this point of time and start reading. Don't think about whatever has happened is gone into vain. your whole 1 year of preparation is into vain. There is no point of thinking all these things. You just need to buck up and start preparing from today onwards. Okay, that is how you will crack this.
If you feel that your preparation has all gone into vain, it will come to a point that even our teaching has all gone into the vain. So we don't want you people
So
to.
we don't want you to think about it. Okay, see, whatever you have read till now, definitely it will help you. Definitely it will help you. It is not like these things, whatever subject wise you have read or whatever part you have read till now, it won't help you. It doesn't happen. It doesn't happen that way. Okay, but just an extra effort to what you have not read till now. So the general surgery part, if you have neglected it to a greater extent, thinking it was only for 40% of marks, then definitely you have to buck up and read your general surgery part. And yes, one more thing, even I believe that the MCQs from CTVS, the cardio thing and the vascular part comes a lot from Bailey as well as from Sebastian. They give a
Yes.
lot of weightage to vascular and CTVS part. You are very
Yes.
right on this.
Yes.
Because in
Right,
our
but
paper also, in
yeah,
our
I
paper
have
also,
faced it.
we got a lot of questions. So it used to be like before our year, before 2017, every year they would choose one topic. Like 1 year it
Yes.
would be vascular, 1 year it would be more of ENT ortho, one year it would be more of skin and
CTVS.
anesthesia.
Yes. Yes.
Yeah,
You're right.
so it was
Absolutely
that
right,
way.
ma'am.
But then from our till our year, all the 3 years, 2015, 16, 17, all the 3 years, there were at least 15 to 20 questions from CTVS and vascular. So that carries a lot of weightage actually, and that becomes the deciding part actually. Based the
Yes.
ranking goes haywire if you get these questions wrong. And these
So
are all,
when
as he said, these are all basic questions, all basic
yes,
questions.
and in 2016 when I gave my exam, I
Hmm.
I got some 12th rank or something in DNB, because it was a common exam then. So I
Okay.
lost my ranks just because CTVS. I think out of 30 I could just answer 4 or 5, because that's the neglected part. We don't really read about all these shunts. We don't. They'll ask a lot of
Right.
questions on
yeah,
shunts.
same with me,
Right.
even
The
sir. Same with
CTVS
me.
shunts. They'll ask a lot of questions.
In fact,
So that is
during this
where I lost the
2017
game.
paper, there were 3 questions based on a single classification of the dissection, aortic dissection only. That there were 3 questions asked on the same
Yes.
classification as well as complications of that dissection, something like
Yeah,
that. It was three
Yes.
questions
it
based
was
on only
it
one
was
topic.
12 question from CTVS, ma'am. I answered only 6.
So that's what it becomes
Yeah.
a deciding factor, no? So
Yeah.
we have to give a lot of
Yes.
weightage, and it is all. And the more the reason that you should read it now is that because you have read only your subjects till now. You have neglected totally
So
your general surgery part. So definitely you need
yes.
to go into the CTVS in details now.
Yeah,
So now what I
CTVS
would say,
and
Vipin and Madam, what we will rather do is, now the situation is like this. So evening, my recommendation would be, I think that's what many of them would do too. Evening about 4 to 5 hours for MCQs, and daytime I would recommend them to start with basics in Bailey and Love and Sabiston, and also CTVS. These are the things I think they should concentrate more, because I'm sure when it comes to GI surgery or surgical oncology, breast, thyroid, even for their MS exams and all these things, I'm sure they would have concentrated so much on this. So putting them aside, rather than in the early few days, like the next 10 to 15 days, concentrating on these topics, probably reading them once and once over and over again, and then maybe a little bit of thyroid, breast, GI, and all those things should come into the picture, and then revising all these things about for 2 more times before going to the exam, and giving priority to basic general surgery and CTVS surgery at this point of time is better, according to me.
Right, I agree. I totally agree.
so
So because breast and thyroid, breast, thyroid, GI, liver, all these things. And again, liver wise also, Sabiston. Just reading Sabiston is equivalent to reading Shackelford. Please don't go with big books like Devita, with big books like Shackelford and all these Bloomgards and all. They don't play much role at this point of time for this pattern. That is what I feel. Because the subject is wide, so they cannot be deep in the subject. They have to be very superficial in the subject, because the subject that they can ask from is wide. But if you have exclusive GI oncology, the subject is narrow, where they will tend to go more deeper into the subject. But now, because the subject is wide, they may not go all that deep in. That's what I feel. So going to this big major standard books does not make any sense at this point of time.
And one more thing, the last 5 days, see, we don't understand what to read exactly in the last 5 days.
Don't
So
read.
what?
Don't read.
Don't read exactly.
read.
Don't read, and just go through the picture
Previous question.
in Bailey as well as Sebastian, and go through the
Tables.
tables in Bailey and Sebastian. That is what
Yes.
I suggest. Pictures and tables. That is all what you can do in the last 5 days, because the mind doesn't
Yes.
work. If you try to
Because
read something, it doesn't work out.
What you cannot do in 1 year, you cannot do it in 5 days. So the best you can do is just tables and pictures for the last 5 days.
Yeah, or you make the notes and then you can revise your notes. Don't read the new things.
That's even better. But even for people like me who don't make the notes, so it was tables and charts.
So what I do personally is that when I prepared this, I just making the hard points, what are the I'm forgetting point. I make a book of 200 pages and just writing this point. Okay, I'm forgetting this classification name. I'm forgetting this most common site. I'm forgetting this flow chart. So I marked that points. In the last 3-4 days, I just remembered that part, and it helped me a lot. It helped me a lot because I selected because of that part only.
Yes, I
Yeah,
get
true,
it. So
true.
now,
Whatever you have marked that you can't remember at the last moment, definitely that part also
that will work
has to
out.
be
True,
included.
that's
Yeah.
true.
Yeah.
But that
Basically,
has to
you
be
have to
started.
divide. You have to divide your
that-
study and
yeah.
smartly. Basically.
Yes.
That book has to be started now itself. Last 5 days, that
Yeah.
book will not.
Yeah. Correct. You have to make the book from today only.
So now we'll go to the questions, Vipin.
Oh, Vinay is
A few
there.
questions.
I will ask Vinay also, Shivan sir. Then we'll take the questions.
Yeah,
Vinay, are you there?
Yeah, sir, I'm there, sir. Good evening, sir. Sir, I just want to say what seniors have already told about the nitty-gritties of the present situation. I just want to add one thing, that adaptability to this situation is the most crucial point. Now, from 40 plus 60 pattern, you need to move to 150 question pattern. So that thing will require a lot of mock questions, mock test paper solving, at least weekly pattern. So my point is, apart from studying the basic questions from Bailey and Saristan, do solve mock test papers as frequently as possible, because now a 150 question pattern is actually going to be a lot different from what you've been doing as 40 plus 60 pattern. So quick adaptability is very essential.
Yeah,
True.
correct, Vinay. Even my boss says that we says like that practice makes perfect, but my boss said that perfect practice makes you perfect. If you practice imperfectly, it will not make you perfect. So you have to start your practice from today only.
Yeah.
That is now 150 question. You have to sit for almost 2.5 hours. You have to think for 150 questions. Before that, you are thinking of 1640, almost 100. So your mentality also will be changed.
Because what happens many times, as sir have already told, that many times there will be simple questions. Because of wide coverage, what will happen that you may not have revised them so well, you have not solved them before, and you will be having an idea about them. But just little bit of more, if you could have studied, we have gone through the question before, you will be able to solve within a matter of seconds there. But if you have not done, if not touched those points before, those very simple questions may go wrong and they will be the deciding factor. So my point is just this one: do solve a lot of questions from now topics from subspecialties. Swords also, I would say at least few selected topics do read from swords also. Many times they try to find out what is not given in Bailey and Saviston, what is important, and it is specifically given in swords. So we would try to include those points in our mock test papers also, so that you don't have to waste much time or those kind of things. Nevertheless, do read at least basic things from swords also.
Yes, correct. First read Sabistan Valley, then if you have time, you have confidence enough, go through swords also, because that is a deciding factor. The 15 questions will like that only. So Vinay, can we take the questions? Shivan sir, can we take the questions now? Hello?
Yes.
Yeah.
Hello.
Yeah, we'll take. So I will take from starting. So there are Sebastian full or belly general part is must. So Sebastian is full and belly all is must. Belly you cannot skip. First read belly, then Sebastian, then go to the questions.
Absolutely, sir. You just cannot miss points from Bailey. Bailey is absolutely essential, and Sebastian is like for gastro part, for even CTVS in detail and important questions. Those things have to be included.
Yeah.
As far as 20 and 21st edition difference is concerned, 95% is the same. So don't get too much confused about 20 and 21st edition. Those
Yes.
points which are separate, which are new, be it data, new pictures, images, or very few selected topics given, those things only have to be included as 21st. Otherwise, what you have already marked in your previous edition book, do go through that, because image memory, that page memory is very essential in exam. So keep that also in mind.
Is correct. Then do we need to read ortho ENT part of the belly? Yes, you have to read ENT ortho and subspecialty part from the belly also. Because that the simple question come from the same ortho ENT, you have to answer.
Absolutely, sir. Now, since this pattern is all inclusive, so they do want to assess as a general surgeon. And as a general surgeon, one will require ortho and ENT knowledge as well. So they will touch upon those topics.
Yeah. The next is the incontroversial question, what to follow, belly and Sebastian.
You have to read the language of the question. You will get an idea of where likely it has been framed.
Yes, correct.
If you, that may be a guiding factor. Apart from that, as far as gastro concerned, definitely I would suggest Sebastian would be more thoroughly inclusive.
Yeah, what I say ki when the subspecialty questions are coming or general part is coming, prefer the belly. When Sebastian, you have to prefer for GI surgery. It is must. Then should we go through the old DNP papers? And if yes, can we get old DNP question papers? Yes, the old question you have to go through. We are including in these questions in our mock test series, and we'll provide this NEET SS old papers also. You have to do the questions many times. As much as you can repeat the questions or you can do the MCQs, you have to do.
One thing, Vipin, I just want to tell you. Sorry for cutting.
Yeah, no issue.
So there was a question like the previous question is between two, the ambiguity question and all. Remember one thing: ambiguous questions are not going to decide your rank.
Yeah, definitely.
Ambiguous questions are making you waste. Your time on that question during the exam. And always remember, out of the 150 questions, 80 to 90 will be repeats. The 10 questions will be ambiguous questions like this because they want you to put your head there and waste time on those questions so that you will hush up with the remaining questions. So ambiguity questions will be there. Obviously, they will be there. And your thing is to decide what those ambiguous questions are, and avoid answering those questions unless you are sure about the answer. If it comes to specialty, I would say Sebastian would be the better option. But if you again of general surgery part, I think Bailey will give a correct answer for that. But you should read to the statement given.
Shivan sir, your voice is breaking. Okay. Then the question is Sebastian 20 or 21st. We already gave the answer. Almost part are same. Just go through the Sebastian 21st. If you can, you have time. Just do the common things or what are topics added. Then you can do. Or you can see our videos on Sebastian update that particularly they are differentiating between 20 to 21. If you like that, you can subscribe that. Then can you tell what topics might come from the SWATs? Vinay?
So definitely endocrine, as already told, that breast, thyroid kind of topics, definitely they are more thorough in SWATs. Apart from that, even from general surgery, there is some few fine differences which is given in SWATs only. So pathophysiological aspects, there are questions which are more relevant from SWATs. So those points have to be included. We'll try to cover them in our mock test series also. And I would suggest aspirants should go through those things.
That's great. Then what about plastic surgery? People are thinking, what do they have to read for plastic surgery?
Plastic surgery bits and pieces is given in all three standard textbook. Needs to go through them all. Apart from that, see, basic questions would be the same, sir.
Yeah,
The idea is to based on that knowledge, the MCQ has to be solved. Many times, what happens in exam, you have already studied those things, and questions based on those particular theoretical part only, they may be confusing. So they have to repeat same topic again and again, and question needs to be solved on those topics.
And there is one small textbook called Self-Assessment and Review of Plastic Surgery by Ramesh Chandra and Rajiv Agarwal. It's a small, about I think 200 to 300 pages textbook. It contains all the previous MCQs pertaining to plastic surgery. So bits and pieces from Sabiston and all these things, and this particular book I think should do. It's from JB Publications. Self-Assessment and Review of Plastic Surgery. It's a simple, small book. You can use that.
Yeah, belly plus GI and subspecialty from Sabiston is enough. Yeah, it will be enough. Along with you have to do MCQ multiple times. Old repeat questions you have to do. Then that GI, that subspecialty you have to read from belly and Sabiston also. Even for my exam, the questions came on jet plasty, what are the triangle, what are the techniques and all. So that they will cover one or two questions also in your general surgery part. So for plastic surgery or any other surgical branch, that belly and Sabiston general surgery part is must. If you read that much, you will get good rank in the plastic surgery also.
And there is one question: can we read Pritesh Singh for GI surgery as replacement for Sabiston, as it would be difficult to retain Sabiston at this point of time? I would say you can do it, but I think Pritesh does cover quite a lot of questions.
Only
but I
thing
think
is
Madam
Pritesh
is a
Singh
better.
yeah, Pritesh Singh is volatile. You read, you will forget. If you have
You need 2-3 revisions.
Yeah.
At least not even 2-3, 4-5 revisions before you go.
So you decide which way you have to go, how you are in mug up and things like that. How can you remember the things? How efficient you are to in mug up? If you are in good in mug up, go for this thing. No harm from that.
Absolutely correctly, sir.
Yeah.
Yeah, sir. The thing is, questions are many times they are simple, but at the same time, NEET guys, they tend to throw conceptual questions.
Yes,
so
correct.
solving them, you need to have a go through the standard textbook also.
Yeah, they have to, true, very true. Basics always works. If you have basic, you can solve any questions. These are the tricks for last moments kind of thing. But for first month, just try to go for your basics. If first create your basic, then you go for this shortcuts. These are all shortcuts. Any other question anyone want to ask? Yeah, any book which giving the CTVS or general surgery part, the surgery 6 or thing, any book which is giving enough knowledge to you, you like it, you just cover it. Belly, hand surgery, you can read belly and Sabiston. Belly and Sabiston, you cannot escape.
See, hand surgery, there is a little bit in trauma and infection also that will be there. So hand surgery does make, you have to go through hand surgery as well.
Yes, correct.
I would also suggest that at this point of time, divide any subject and topic as a must know, should know, and could know. As already explained that instead of going into too much depth, the wide knowledge is requirement of the time. So you should be covering what is essential of the every topic. It should not happen that you are reading upon one topic in CTVS and you have divided maximum time on that only. So know about the maximum coverage of the important points of each topic.
For neurosurgery, the basic questions will come in general surgery part that will come cover in the belly. So no need to read additional to the for common part. Yeah, we already conducted our classes on general surgery part. We conducted our series on the Sabiston update. We already launched our test series on the mock test series of 150 questions. Every Sunday you will get with explanation till NEET SS. Almost 10 papers will come, almost 1,500 questions will come. It will help you a lot. So do the things, start now. From where to solve chapter wise MCQ, either from test series or Pritesh Singh or some other. So test series, chapter wise, you can go from Pritesh Singh, or you can subscribe a test series of topic wise grand test. There is a 10 topics we provided, almost 500 questions we already provided. You can go through that also. It will help, and you can go Pritesh Singh, no issue. If you already subscribe for test series, you will get the things free, nothing to have to pay. See, our team almost is mainly into help. We don't want any financial things. So just whatever you subscribe, you will get your test series part of mock test that we are upcoming test series part. You will get in your subscription. No need to pay extra. It's free.
So biostatistics and COVID in surgery, I don't think so many questions will be asked from those things. There are two out of the things to be asked. Biostatistics, I have not seen any particular question in any of this thing. But when I wrote my DNB exam, there were a couple of questions. Something like question on some Kaplan-Meier curve, which is the best way to represent. Those one or two questions were there. But I think if you just go through the biostatistics chapter on SPM textbook, not textbook, I mean SPM, what do you got? Any entrance book will be good enough. I don't think you have to go in detail with all those things. So if at all there is a question, there will generally be a repeat out of it. And COVID, I don't think they will ask so much, because there is nothing standardized about COVID to ask as a question. It is all like a trial and error type of treatment that we're giving.
Yeah, but basic thing you have to know that the biostatics, like sensitivity, specificity, basic types of curves and graphs, what is the standard deviation, and the basic definition. Definitely one or two questions you will have your NEET exam. So that is also important topic. You have to read from somewhere. Either you read from Belly. I'm not remembered Belly is given or not given, but read the basics for the what is the mean, what is the median, mode, then this one sensitivity, specificity. Because in DNB part, when you clear giving the DNB, when DNB was separate exam, they will ask the statics part also. Even for now in the DNB, that for MCH or DNB for post this one subspecialty, they're asking stats. So stat is also must. You have to read stat at least for 1 or 2 hours. Just make notes of a few definitions. That is more than enough for you. Yeah, for a semester, if a chapter is given a stats, that will be more than enough. Just spend 2 to 3 hours on the stats and make the notes of that topic. That's more than enough. If they ask high, deep question in the stats, no one will be able to answer. So leave that part. So, but basic knowledge you should have for stats.
I think the same thing will go even for the medical people as well. So medical I don't think there's much to discuss as here.
Medical people also, they have to read their basic books. The pattern will be the same for general medicine part. Specialty part will come. So pattern will be the same. Ortho ENT, first read from Belly, then you have time to read from Sebastian. How to read Sebastian? What are the important topics? How to read early? That's the people are asking.
I would suggest Sebastian as such. It's a very methodically written book. Everything I can vouch for, at least gastro part, very well written,
that's
thoroughly
true.
given.
Absolutely true. It is like a small gist of your Shackelford or any other standard textbook. Even if you just go through the liver or any chapter in Sebastian, it is as good as reading any of the standard textbook. It has given each point there was almost equivalent to an MCQ. Each point, there is nothing. So when you come to specialty, you'll be talking more in terms of what is called as evidence-based treatment and all. But here in Sebastian, he has removed all the evidences and he has just put what is the standard treatment, standard of care that is required, all the pros and cons. So I think Sebastian for GI surgery is an amazing book to read.
Absolutely.
That's correct. For CTVS, read Belly first, then Sebastian. So Belly is the base, then Sebastian you can upgrade your knowledge.
Yeah,
I think this
both will be.
Yeah, this is the basic crux of this meeting, like Belly, Sebastian, Pritesh Singh. Like this should be a sequence kind of thing. Then MCQs.
I would say for the next 10 days, at least till maybe September 10th, I would recommend you to concentrate on CTVS little more, because I don't think
Yes.
many of them would have been concentrating it even during MS time or whatever it is. So mostly I would say CTVS 10 days, solid 10 days. If you have a friend who is in CTVS, or you have any of your professor who is a CTVS, taking a couple of classes from them will not be anything wrong. Because I'm telling you, the differentiating factor when we wrote for the 2 years, I wrote from 15 and 16 was CTVS only. So I just don't want you guys to miss that single part and make a
Yes.
mistake there.
Yeah, correct. For my exam also, it was very, very important. I almost did 6 wrongs in the out of 12 questions, 50%. And I scored 93 percentile. So it is a major factor in my success. My rank was little low.
So what is the distribution of 50 questions, 150 questions?
No one knows. But it will be more of
No
general
one
surgery
knows.
part will. No one knows. Even it doesn't matter. But selection, the 80 questions, everyone will be answered. Don't think that even you not read, you will not read, you will answer 80 and 90 questions. The 70 questions is from your knowledge only. So that will come from different specialties, subspecialty and broad specialty. So it doesn't matter what is the distribution. Now it's no use of that. What part of the semester to focus more on? Though we already discussed that GI surgery is to focus more on general surgery from belly. First 500 pages of belly is must. You can read the Pratyasing if you retain it, but it's a shortcut. First go for basics, then go for the Pratyasing.
So for urology, Vipin,
Urology, the belly is enough for you. If you interested,
GIT is Sabiston.
Yeah, GIT Sabiston.
GIT is Sabiston.
CTVS belly. Then ENT ortho gynec part is from belly. Stat, you have to think. I'm not remembering which book is better for stat, belly or semester, but you should know the basics. Yeah, orthopedic part you have to read from belly. Subspecialty you have to read. Neurosurgery also you have to read from belly.
Next question. Yeah. How to manage negative marks? How to manage negative
Shivan sir,
marking?
you are expert.
Good question. Good question.
Yeah. Correct.
So what you need to do is, it is a simple logic. So it is a 1/4 negative, right? So it is 1/4 negative and 4 positive. If you are correct, you're getting 4 marks. If you're making it wrong, you're losing 5 marks. Remember that. It is not losing 1 mark. You're losing the 4 marks for the question and 1 mark for negative. So it is 5 marks that you're losing. So always remember, whenever you answer a question, even if you know the answer correctly, please read the remaining 3 options. Try to eliminate them, the reason why they are not correct, and then only mark the correct option. Make this as a point, make this as a practice when you are going out, even when you're doing this practice text. There is no ideal number to say how much you are supposed to remove. The ideal number will be based on how much you have studied. If you have studied well, your ideal number should be 0. If you're not studied well, your ideal number will be based on this particular mathematical calculation that I'm going to tell you. Okay? So out of the 4 options, if you are able to eliminate one option and you have a doubt in the remaining 3 options, go with the option that has come first in your mind. So you will first answer a question, at least if you are able to eliminate one option. If you are not able to eliminate any of the 4 options that is given, please don't answer that. If you are not able to eliminate even one single option out of the 4, please don't answer that. Just leave it. If you are able to eliminate one option, in the remaining 3 options, the option that comes into your mind first as a reason, mark that as the answer. The answer that you mark first is more than 70% of the times correct. And if you change the option, it is more than 70% of the times that is wrong. Once you mark it, please make sure that you don't change it unless you are 100% vehemently strong about it. Okay. So next question is, when you're able to eliminate 2 options, again, out of the 2 options that you are not able to eliminate, the option that comes first into your mind is the answer. So whatever you are able to eliminate, you should be able to eliminate at least one. If you are able to eliminate one option, Out of the remaining 3, whichever option comes into your mind first is the answer. And remember, out of 150 questions, there will be at least 10 questions which are out of the blue, which are not given in any textbook, which are probably there in some very old edition, which are not there in the current editions. So those kind of answers are ideally to be not marked, because I'm sure you'll not be able to eliminate any of the option. And second point is, those are the questions that are not going to decide your rank. They are not going to hamper your rank. Instead, if you don't mark such answers, you'll get a better rank than marking something. So if you're able to eliminate at least one option, the option that comes in your mind first will be more or less the right option. So how many to be left behind will be based on how much you study. If you're able to study well, there'll be at least very few questions where you cannot eliminate any answer. So you will be able to mark. There is no particular number to decide how much about it is. I would say on average, there'll be 5 questions which will be very difficult and out of the blue.
Yeah, and one more thing I have to add in this: don't attempt. See, you will leave. You have time around half an hour or 20 minutes. Last time moments time will be there for you. So don't attempt the answer if you don't know in the last 2-3 minutes or 5 minutes. If you don't know answer, don't think about much of 5 minutes. That will be 4 or 5 questions will be there. And second thing, then people are asking, tukka kaise marna hai? How can we put guesses and all? So like Shiven sir told already, if you don't know 4, don't attempt. So, and one more thing I have to add, you have to judge yourself on the exam, ki what is the pattern, how tough it is, and how you did. If you think that is you did reasonably good in this exam, don't attempt much questions. If you leave 10 or 12 questions also, doesn't matter. But make sure that out of 150 questions, the 70% questions you should attempt. That should be correct. That your number should be more than 70%. If it is not there, then you think according to you. Then in exam, you will realize ki you are in or not. If you are thinking you are in, you did reasonably good, don't attempt go for the guess or tukka, until unless you are sure.
Then can you please clear whether this time we can decide 2 specialties? No, that is not decided before the exam. It will be decided after you get your rank. Suppose you get first rank, you will have the chance to choose the college as well as the branch of your choice. Okay, so you can put number of options. I think when Vipin was there, they have given it 200 options, no, to put.
Yeah, 200 questions. 200 questions they gave. No,
options to choose after you get the rank.
No, it was
options to choose.
No. Yeah, you can fill the every subject you can fill. Like onco surgery, what is my preference? What is the GI surgery my preference? So you have to rank yourself according to your college. So suppose I am thinking ki I should get AIMS, sorry, not AIMS. I should get Safdarganj first onco surgery, then or second option it can be urology from the PGI. So like that we have to fill according to our rank. So they will match the sequence for everybody. Ki suppose someone opt already Safdarganj Delhi for onco surgery, he will get. If you not opted, you will get like that. It will be matched. So you have to decide your branch first, your college first, then you have to fill that is a different part. You will know when you will get select first. First start study, that is more important. It will be complete chaos on my time.
The questions that are coming now are all based on what is going to happen after the exam. But I would recommend you to first concentrate on the exam. Try to get first. Try to guess in the first few ranks and then you decide. Obviously, it will be another difficulty once you get first rank to choose which branch. That is difficult, and that is an easier decision to take. But getting a rank will be much tougher than taking that decision.
Yes, I just want to add at this juncture, what is most important is adapting and acquiring knowledge as per the present given situation. What will happen after the result can be decided later only.
Yes, correct. You have to cross the bar first, then only you can play the game.
It's like as if you have crossed the river, and on the other side of the bank, where to go around is what we are searching out for. First, we didn't find a way to cross the river at all.
No, you will not have any choice. You just have to fill the form. You have to choose your specialty. whether you want to give ENT also or not, kind of thing. But for general surgeon, for MS people, for general surgery people, you don't have much choices. It's straightforward.
So
it doesn't matter.
someone wants to do gynec oncology, someone wants to do ENT, he has to fill up general surgery paper, he has to give exam for general surgery, he has to give exam for ENT, and also he has to give exam for gynecology, all three.
Yes, correct. There is a 3-time charges, I think 4,200 for one paper, and that's multiplied by 3 paper for you have to file. So leave it that part, that is a different story. First focus on your basics, start reading from today, and we'll see after 70 days how it goes. Don't worry, you people, if you read for reasonably, or if you read basics, you read something from your last 3 years or 2 years, 3 years, or whenever you get time, it will be more than enough. But the 70 days, you have to put your heart in your study. You have to work hard. So work hard, put your heart.
Irfan, no, you'll not get an option to choose the preference. You will have to just pick up general surgery and write the question on general surgery, write the paper on general surgery, and then you will be given a particular rank, and based on the rank, you can choose the branch and the college. So upfront, you will not be choosing any preferential branch or something. Upfront, you will only be choosing general surgery paper.
Correct. So people working, how should manage? If you are working somewhere, then go for the MCQ based pattern when you are on the duty. So solve the more MCQs when you are on duty or working. When you get time, read the theory part that you can manage.
But madam, frankly speaking, making two things from this point of time would be slightly difficult.
You have to leave.
Slightly difficult. And it depends on how much you have already prepared. If you're prepared well so far, it is a different story. But you know, in the last few, at least 60 days, 2 months, I would recommend you to, you know, at least take a small gap and then prepare for the exam and decide what is more important for your practice or your super specialty. That you have to decide personally.
Yeah, you have to decide what you want more. You want to be 2 boards kind of thing. You want to clear. For me, it was like that I have to do on this time. So I prepared like anything. I was sleeping only 2-3 hours last 35 days. I just prepared the 35 days and cleared. So what I think, leave everything if you want to truly want to be clear this exam, and that will be your game changer or life changer exam. This is your last exam of your life. So give the importance to it. Okay, with this, I think we can end this. So what I can say ki, for general surgery part on DNEX Academy, we have one WhatsApp group, and Vinay and every faculty is putting the questions. You can attempt them. We are launching our test series of 150 questions every week. So it will be 10 tests for next 10 tests for next every Sunday. You will get 150 questions.
Vatsalya, you are supposed to give for gynec oncology. You are supposed to give OBG paper. You are supposed to write OBG questions where you will have both benign and malignant OBG questions only, like from OBG standard textbooks. Those will be your questions. And then if you get a good rank, you can choose gynec oncology. Even though you have done general surgery, you cannot write general surgery for gynec oncology. You have to pick up OBG as your feeder branch. You have to pick up and write OBG questions, and then only you can join gynec oncology.
You have to MS gynec. You have to give the paper of gynec and general surgery both. Okay, then with this we'll end.
No, you are eligible. You are eligible. You can write, but you will be given questions. Your entrance, you can write, but while you go for the entrance exam, your questions will be on Ob-Gyne. It will not be on general surgery. So if you are well prepared with Ob-Gyne, you can definitely write. There's nothing that you cannot write. But the chance of you getting when compared to a person who has already done 3 years of Ob-Gyne is much more. That is what we were trying to tell you.
That's correct. Yeah, image-based question you will get on DNEX paper. That will be complete test. You almost 1,500 question will be there. Out of that 150 question, you definitely will be from our test series. Last year also the same happened. So just I request, if you want, you can subscribe us, and who already subscribed, no need to worry. You will get these papers in your subscription. We have videos. You can subscribe on monthly basis or yearly basis. We have subsequent updates, notes, everything is there. If you want, you can subscribe us. Thank you, everyone. And we will arrange another session when it is required, most likely with just before the exam. We'll see how it works. And for any help, we all are here. You can call us anytime. You can put messages. We'll try to help you. Thank you. Thank you very much.
Bye,
Thank you,
Vipin.
Shiven sir.
Bye,
sir.
ma'am. Bye, everyone.
Thank you, Vinay.
Thanks, sir.
Thank you.
Thanks, sir.
Yeah, bye, sir.